Hello, 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 Greensboro, surrounding areas. Welcome to SHEM Ministries. What is SHEM? That is Souls Honoring Elohim's Mandate. And this is our SHEM 2 night. Well, SHEM 2. This is a spiritual, healthy, enlightening mandate ministry. And I am Dr. Anna Shaw Devlin. I am a family nurse practitioner and I love, oops, here we go again. I forgot about that alarm. I need to turn it off. But I am someone who loves to teach and educate God's people. And each and every week on Tuesdays, and I do apologize for the tardiness, but I was hunting something. It's a prop that I needed for tonight, and I found it. So you will pardon me once you see that I found something that is going to help us illustrate what we're talking about, because it's something that a lot of people don't even realize exists. So, like I said, my desire in this ministry is to educate God's people about the things that, there's a lot of common stuff that most people know: hypertension, diabetes, sleep apnea, and certain cancers, we talk about all those things. We talk about kidney disease. But this week and next week, I want to talk to you about glands. I want to talk about the two main glands that I want to talk to you about are your adrenal glands and your thyroid gland. Okay, so we're going to talk about adrenal insufficiency, and we're going to talk about thyroid disease like hypothyroidism and hyperthyroidism. These are things that we've not talked about yet, but they're important. And I want to make sure you know what you need to know to tell your doctor, right? They shrug things off, and here I am. I'm a healthcare provider. I think it's me as a nurse for 30 some years and a nurse practitioner that has, I would say, I'm not going to say the glue between, I'm going to say the bridge between the patient and the doctor, right? Who many times don't think the way we think. Everything is scientific for them, and it's actually the school of thought. It is how they were trained. They were trained to diagnose and treat. If it's torn up, fix it. And this is what it takes to fix it. Not research and dig and find out more. If it's not broken, they may not seek and search for it. But here's a plug for nurse practitioners. We do. Because it's just what we do. We've been on the other side, being the patient advocate for so long. So that was my introduction as to how passionate I am about presenting things to you that may not be thought of, because you have not or don't know enough to piece it all together. So most people don't talk about adrenal glands and adrenal insufficiency until you in trouble and there's something clearly wrong with you. Okay? I want you to be aware that these things can creep up on you, and I personally want to know before it's torn up. I don't want to wait until it's torn up to try to fix it. No, because why? Why should we? Okay? So, Father God, right now, in the precious name of Jesus, Father, I ask, Lord, that you bless me to bless your people. Father, I empty myself out. I am an empty vessel for you to fill and use. Use my mouth, my hands, whatever you need, my eyes, whatever, God, to be what you need me to be. So we ask that the hearers on tonight will be receptive of what's being said. Take the information and marinate in it. Don't wash it off. Marinate in it and let it season you to be the patient that you can be for yourself. Okay? So many times I've thought about being the provider, a seasoned provider, but we as patients, we need some seasoning too, because if you walk in there with nothing, you may come out with nothing and not get what you need until, I hate to say it, but until you're half dead. And then everybody's crying out to God, even us. Lord, if no one can fix it, you can fix it. Well, God said, teach my people who are destroyed for a lack of knowledge. Teach them and educate them. And that is what we're doing. So tonight, you'll see the topic. It is fight or flight versus fatigue. You either have the fight or flight in you, or you have chronic fatigue. And we're going to talk about what that means. And we're going to talk about the difference between chronic fatigue and hypothyroidism, because there's a lot of similarities, but they're different. Okay. And we're going to talk about testing that's done, that can be done to differentiate the two. So as I mentioned, this is going to be a 2-part series. We're going to start out tonight educating you on adrenal insufficiency. Okay, pop quiz. How you going to give a pop quiz and you ain't even presented? Where are your adrenal glands? Does anyone know? Where are your adrenal glands? All right, so now, don't even ponder whatever. I am getting ready to show you. I dug out my model. Look what I found. And I was trying to match, but I'm off a little bit. You know, that's me, all right? See my bean-shaped kidney. My bean-shaped kidney. So where is the adrenal gland? This thing right here that sits on top. Let me turn it around, because this is the dissected view of the kidney. See? Here's our kidney. We have 2 kidneys, and on top of our kidneys sits this gland. It's called the adrenal gland, and most people don't even know they have it, or where. You may have heard of adrenal gland, but you thought it was up in your head somewhere. Now, this is your adrenal gland that sits on top of the kidneys, okay? Now, let's talk about how important this is. You don't even realize how important these little glands are. until they can't do what they're supposed to do anymore. All right, so I'm gonna put my little image down, and we're going to talk. So, imagine if you awakened every morning feeling completely inadequate. I mean, no energy whatsoever. Now, and this is after sleeping all night. First of all, you can't even entertain the thought of having adrenal insufficiency, which means anything insufficient is not working appropriately, okay? You can't even dream or think of it if you know you don't never get no sleep. No. Sleep and sleep, good sleep, restful sleep, and still have no get up and go. No get up and go. And the other thing we have to rule out, the two main things, is insomnia and depression. You have to make sure that you're not suffering from depression. And that's a whole nother ball game that we've talked enough about anxiety, depression, and insomnia over the last years, or 2.5 years. So I don't need to rehash about depression, but you make sure that you've slept well and you're not suffering from depression, because depression can make you feel fatigued, okay? But rule all that out. You waken every morning feeling completely inadequate to meet the demands of the day. Like, oh gosh, I don't know how I'm going to get this done. Simple stuff. How would you feel if even a little physical or mental stress left you feeling drained? Little. You get a phone call that your such and such is due, and they're getting ready to turn your lights out, and it stressed you so bad that it just wore you out. You couldn't do nothing else the rest of that day because it took all your energy. Or getting a bath takes you all day. Okay, let's keep going. Or mental stress, drained. And that was the reason I used the analogy about a bill, because that can stress you out. Like, oh my gosh, how am I going to pay this? Or I can't believe I forgot to pay this. And just the thought of having to go get a cashier's check, go do all of that just wore you slam out. Whatever you had to do. Even if it was an electronic, just calling and being on the phone and trying to get this, if that stressed you out to the point where your mojo was gone. Okay. So problems such as these have an enormous negative impact on our relationships, that's our careers, personal happiness. It just leaves you blah, 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 blah. Okay. The root cause is very often impaired adrenal and or thyroid function. If you don't know what adrenal insufficiency is and you don't understand thyroid disease, you would think it was something else that it's not. So that is the reason why it's very important that we talk about these things. So what I want to now talk to you about is what the adrenal gland does and why it is so important, and why if it's insufficient, it's problematic. Okay. The adrenal glands are responsible for releasing a hormone called cortisol. And it's a glucocorticoid, So cortisol, you hear people say my cortisol level, or let me see. The most time you hear someone talk about cortisol is when they're stressed. They know that cortisol is released when they're stressed, right? And it is released from the adrenal gland. And it's a glucocorticoid. It's a steroid. It is not the steroid that the doctor gives you, like prednisone, solumedrol, decadron, right? To decrease swelling and inflammation. It is a steroid hormone that gives us that stress hormone. It is what fight or flight. It is what allows our body to act when it needs to act. It is when you hear people say, I don't know where the strength came from. I was able, my muscles and everything, I lifted more than I ever thought I could. Well, that was cortisone, the steroid burst. That is, the weight lifters and bodybuilders and how they get in trouble for being on steroids. So their muscle mass and their strength and all of that was steroid induced. So what they're actually doing is mimicking the body's natural cortisone by taking it as an injection. Don't get me wrong, steroids are good when we are sick. They are many times necessary to promote healing of our bodies. So if our natural, and as I go through symptoms and stuff, you'll understand why adrenal insufficiency is so important. We don't get that. We stay sick all the time. You stay sick all the time because your adrenal glands are not able to produce the natural steroid that your body needs on a daily basis. Okay? It's insufficient. And then we're going to talk about how it gets insufficient and all those things. And so basically, you lost your fight or flight. That's why the topic tonight is fight or flight versus fatigue. Okay? So, like I said, it's your stress hormone. It increases your heart rate. It increases your blood pressure. And it's a natural fight or flight. Point blank. Okay? So, of course, when you think about when your adrenal gland is not working properly, what kind of things do you think would happen to a person? Muscle weakness, you're fatigued, like I said, easily just, I ain't got it, I can't go no more. And you're like, what? We just got started. No, I gotta go to bed. I gotta go take a nap. I'm just so tired. Now remember I said you gotta rule out other stuff. If you're diabetic, it's not because your blood sugar is low. Okay? It's not because your heart rate is low because you got heart disease. It's not because you're anemic because your hemoglobin is low. Now this is just all these other things are how they need to be and you just still worn out. Now, you're not anemic, you're not diabetic, you're not bradycardic or heart rate low. You got a good blood pressure, right? So you have an adequate cardiac output. Remember we talked about cardiac output when we talked about the heart and the chambers of the heart, and we talked about the valves in the heart and heart murmurs, and we talked about the left ventricle, cardiac output, sending all that blood to the body, to the brain, all of that, right? You don't have heart disease. You don't have all these other issues. And you're fatigued all the time, easily fatigued. then we start looking at the adrenal gland. Okay. All right. Now, so the symptoms, you're fatigued, muscle weakness, loss of appetite, weight loss, and abdominal pain. Those are some of the main, a little more in detail over between this week and next week. Now, let me just read a little bit more stuff to you. Let me see if there's, okay, let's talk about the adrenal function itself, because I want to give you some history behind how it was discovered. Believe it or not, oh my gosh, 1898. 1898? And they don't talk about it? Like, they don't just know, because there's so many other things that can make a person feel fatigued that they don't really think about the adrenal gland until it's like clearly obvious. And then there is primary adrenal insufficiency, and then there's secondary adrenal insufficiency. So you mean to tell me that there's hormones that stimulate the adrenal gland to work? Yep. I'm telling you, the way God created mankind, the way God, that's why I love what I do, because I love God. And I'm just so amazed at how he made man in a day. Wow. And how he took just one little rib and made a woman out of man. Oh, wow. Awesome. All right. So the adrenal glands, I'm just going to read this because maybe it says something that whatever. The adrenal glands are two small glands, like I said, about the size of an acorn. So, of course, now this is a big model, but your kidneys are tiny, right? They're real small. Acorn. This is a model. Look how big that is. An acorn? Like an acorn? Yeah. Oh, I'm sorry. You can't see what I was doing. A small acorn. One sitting on the top of each kidney. The adrenals produce many hormones that keep us healthy, both physically and mentally. As early as 1898, Emile Sergeant, and his name is spelled Emile, Sergeant, Sergent. He was a great French physician, described the two prime functions of the adrenals, and they were antitoxic and angiotonic. So remember what I said about God made us where things were homeostatic, where things would be just right. Like you're either neither here nor there. You're right in the middle. Okay? Because it's the way God intended for things to be. His description of the detoxifying functions of the adrenals was brilliant. Should these glands happen to be damaged, a condition of depression and muscle fatigue is seen to appear, which in man we shall find, and these are quotes of his words, we shall find in the form of the earlier symptoms of adrenal insufficiency, asthenia, which is physical weakness and loss of strength. Functional adrenal insufficiency, so there are people who have adrenal insufficiency and they still can function, is due to a number of factors. Inadequate development from birth. Oh, you mean tell me that the adrenal glands could have not developed like they need to from birth? Really? Yep. Okay. Exhaustion by fatigue. So you can be so fatigued and stressed. Now, normally, the fight or flight kicks in, but if we're still under attack, you can easily get exhausted, right? So that can happen from prolonged exhaustion, prolonged fatigue, right? Prolonged need for steroids, that you overwork the adrenal glands because it's been going on for so long that they just say, whoosh, I'm done. Can't do no more. Okay? All right. So that's how the chronic fatigue kicks in. Because they've been so overworked that they just, it's just like when we talk about the pancreas with diabetes. Your diet, the amount of sugar, the pancreas inability to produce enough insulin causes hyperglycemia, and you end up over time becoming type 2 diabetic from overworking and fatigue to your pancreas. And the pancreas is like, I can't do it no more by myself. You got high blood sugars and you need to do something about it. Okay? Or you're going to die from hyperglycemia. Okay? Same thing. Exhaustion. The heart gets exhausted. Blood pressure been high so long. The heart's been working like a racehorse. It's like revving an engine. You keep revving the engine on your car, what's going to eventually happen? You're going to burn up the motor. Same thing with us. There is not one organ in our body that cannot be so worked, that it dies on us. Okay? So, the adrenals can do the same thing. All right. So, age-related degeneration. So, you telling me as I age, they're going to degenerate and not work as well? That's what I'm telling you. Yep. Chronic stress, we already know which, without provoking organic disease of the glands, is capable of reducing their normal activity. Things. You can have prolonged, let's talk about surgery, right? During surgery. And that's the reason why, another reason why I'm wanting you to understand about adrenal insufficiency and to know whether or not you need to have testing done to get a diagnosis. And because during surgery, the body is under major stress. So you need this 13-hour surgery. That is not the time to find out that you have adrenal insufficiency, because the stress of the surgery is going to mess you up. People who have adrenal insufficiency need to have a boost of steroids given to them before surgery. And they may, depending on how long the case is, have to have steroids given to them during surgery. Yes. This is a topic that needs to be talked about, and one that most people don't know exists. Okay? So, other symptoms which may occur. Now, like I said, don't forget you got to rule out other stuff like being anemic, because there is sensitivity to cold, low blood pressure, weak heart action and pulse. Like they say, oh, I hear your heart beating, but it's so weak. Like it's beating, it's not boom, 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 boom. It's boom, 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 boom. But not love dub, 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 love dub. It's weak. Because what is a heart? Is the heart not a muscle? Yes. Okay? Is it making sense? I hope so. All right. So, of course, low blood pressure, weak heart action and pulse, anorexia. Okay. Anorexia is just can't eat. Don't want to eat. No appetite. Slow metabolism and constipation. Now, that's where I said some of these overlap with hypothyroidism, and so we'll tackle that next week. Now, people with adrenal insufficiency often have many symptoms associated with upper respiratory problems. They are the ones who always have a cold because this adrenal gland helps our body heal and keeps us healthy. They have allergies real bad. Helps with our immune system. Hives. And they catch any illness that is making the rounds. Anything that's coming around, they catch it. Because the body can't get enough fight or flight. You don't have enough fight or flight to even fight sickness, infections. You're always sick. To keep you from your body responding, allergies, hives, all kind of, every time you turn it. But guess what the culprit many times is? You're stressed. You've been under so much stress so long. Change jobs if that's what it is, so that you don't wear yourself out. Okay? And I hope this is not freezing up, but I think let me see. I don't know. I thought it just froze a minute ago, so I do apologize. But if the visual freezes, at least maybe you can still hear me talk. Okay, so bear with me, and hopefully I'll get this figured out for next week. There are many other subclinical signs, things that are not clinically, like with low blood pressure that you can test, low blood sugar. Let's see, I got this little yellow thing here. Let me switch. I see what happened. There was something with the Wi-Fi. That's why I'm paying attention to the computer. Yes, I'm looking for that little yellow thing to pop up, and it did. So we're good. Got it. All right, now, I hope that helps. So anyway, I'm not going to get into there's a questionnaire that helps you to know about fatigue and chronic fatigue, and we're going to do that next week, because it's going to help you determine if this is thyroid or is it my adrenal gland. All right. All right, let's move on, and I'm going to talk a little bit more about adrenal insufficiency diagnosis and all that stuff, and how a diagnosis is made. Okay, so like I said, there's primary adrenal insufficiency, which is called Addison's disease. You may have heard that before. It is a rare condition where the adrenal glands do not work properly to start with and cannot make enough cortisol. I'm not talking about where the adrenal glands are overworked and they become insufficient. I'm talking about they just never made enough to start with. It was primary. The gland itself is diseased. Okay, and that's Addison's disease. They do not work properly, cannot make enough cortisol, which is our stress hormone, usually production of aldosterone and androgens. These are the two other types of steroid hormones made by the adrenal glands. Is also low. So it's not just the cortisol level that's low. It is aldosterone and androgens. And I'm not going to get deep into that, but when they send you to an endocrinologist, because that is the person that makes this differentiation between primary and secondary, we leave that up to the specialist. I'm just telling you that there is an adrenal insufficiency that can occur. It's either primary or secondary. Secondary would be because of stress, prolonged stress, or whatever. Primary would be the gland itself. Always remember, primary is the main, and then secondary is always after the fact. Okay. And therefore, secondary adrenal insufficiency is the far more common type. It results when the pituitary gland, which is a small gland near the brain, does not signal the adrenal glands to make cortisol. Production of aldosterone is normally in secondary adrenal insufficiency. So that is one of the ways they diagnose it. Is all of them aren't low. So aldosterone, there is a blood test. It's that is done that helps to make that diagnosis, and it is a ACTH test. Aldosterone corticotropin hormone stimulating test. Sorry I didn't put that up, but I'll try to put that up for you next week. So the adrenal glands do not get adrenal fatigue or lose function because of mental or physical stress. True aldosterone insufficiency is a rare health problem. Only an endocrinologist, an expert in hormones, should diagnose. They abbreviate as AI using standard tests. Now, I didn't expect you to get all of that I just said and understand it. I just wanted you to get the big picture. You identify connection closed by the server. Recover the broadcast. I don't know what just happened, guys. I hope I'm still on. Anyway, let's keep going. The main thing is I need you to understand the nuts and bolts of it. The fact that understand that there could be something wrong that needs further investigation, right? And you need to be able to present that information to your doctor. So if you don't know it exists, how can you present to your doctor? You say to the doctor, look, my blood sugar is good. My blood pressure is good. I've been sleeping, but I'm easily fatigued. I have no get up and go. And the doctor may say, well, let me just check some hormones on you, hormone levels. And there we go. Okay. And that's where we are right now. So the adrenal glands located on top of the kidneys make hormones that are essential for the body's function. The outer layer, the cortex, makes 3 types of steroids. So this outer layer, See, this is the outer layer. It's called the cortex, not the pink center, the outer layer. It makes the 3 types of steroid hormones that I mentioned. The adrenal cortex does not make enough. In adrenal insufficiency, it doesn't make enough. Okay, so it's this outer layer. I already told you what primary was. Okay, and that is the most common cause of primary is autoimmune disease, meaning the body attacks itself. Aren't you guys tired of this autoimmune thing? I'm telling you, when people say autoimmune, they don't realize at any given time, our body can attack itself. My alopecia, the hair loss that I have, is autoimmune. It is. My body, white blood cells, attacked my hair follicles. Yes. I didn't tell it to do it. It attacked them. Yep. I believe that certain things stimulated the attack, could have caused it, but it is an autoimmune. So the body's defense system attacks and destroys the body's own tissues. When adrenal glands are damaged, they can't produce hormones. Other causes of primary adrenal insufficiency includes bleeding in the glands, infection. Yep, you can have an infection. Genetic or inherited diseases, and surgically removal of the adrenal glands, like trauma. Yeah. Secondary, like I said, problems with the pituitary gland cause secondary. Normally, the pituitary gland makes a hormone called ACTH, which tells the adrenal glands to make cortisol. But in secondary, the pituitary gland does not send enough ACTH to the adrenal glands. Therefore, not enough cortisol is made. Okay, so something else is causing it, not the gland itself. Some causes of secondary adrenal insufficiency may be temporary, such as taking certain prescription medicines like prednisone, hydrocortisone, or dexamethasone, Decadron. That is the reason why when your doctor gives you steroids, they don't give you... There's some people who are so sick for so long, they stay on a very low dose of steroid, like 2.5 milligrams daily of prednisone or something like that. But it's not healthy to stay on high doses of steroids. They got to get you off steroids, or you're going to end up with Cushing's disease or, Addison's. You cannot abruptly stop like a high dose. For example, if I've got someone who's having respiratory distress and they are wheezing real bad, they've got a lot of upper respiratory secretions and they can't breathe, their oxygen level is low, I will give them a one-time injection of Solumedrol, or I'll give them Decadron. Decadron is a better steroid. And I may give them 4 or 6 milligrams of Decadron, and that's it, just that one-time dose. Or they can get prednisone, and they may end up getting like a prednisone taper. They may get, well, not necessarily a taper, but like 20 milligrams for 3 days, and that's it. And if you do give them more than that, it's a Medrol dose pack. You'll hear a doctor say that. You'll start out with a certain dose for a week, and then you cut down to a lower dose. You have to taper your body off of it, or you will cause serious damage. Okay? I'm sorry, I can't remember exactly, but it's a storm. Oh shoot. Forgive me, but I'll get it next week. My mind just went blank on it. But I just wanted you to know that I didn't want you to be afraid of getting steroids, but understand that your adrenal gland is one of the reasons why you don't want to take more steroids, and you can't take them so often. Like if you got a bad hip, doc, that steroid injection you gave me, ooh, it helped me so good. You can't get that injection every week or every month. No, it's not healthy. You understand why? Okay. Some causes of secondary adrenal insufficiency may be temporary, such as taking the prednisone. Other causes may be permanent, such as a pituitary tumor, pituitary surgery, or radiation damage to the pituitary. So people who need radiation to the brain or to the head, you got to be careful that those radioactive waves do not penetrate the skull in the area of the pituitary gland. They have to be pinpoint radiation. Technical stuff, guys, because once you eradicate it, it's gone. So, if your doctor's concerned about adrenal insufficiency after reviewing your symptoms, okay, and medical history, they may check blood levels of cortisol. So that was when I was saying that they may check your aldosterone level, check your cortisol level. So they may also check, because this is important too, you have to make sure that your electrolytes are where they need to be, because that can cause fatigue and lethargy and all of that. Your sodium particularly, and your potassium, okay? It's complex, but that's why you have to know what to tell the doctor. And just about every time you go to a doctor's office with a complaint, now you understand why you get blood work done, just about. They're going to run a CBC and a CMP on you, or a BMP. Basic metabolic panel or a complete metabolic panel. They're going to run those. The complete gives them your liver function, okay? And the CBC, you're going to always find out if your white count is elevated. Because if it is, then you've got an infection or something going on. Okay? So get used to it. CBC, CMP, common. They may also look at the adrenal glands or the pituitary gland with imaging tests, such as a CT or an MRI scan. Now, you're not going to get the CT or the MRI scan done until after blood work comes back and the levels are abnormal. Symptoms of adrenal insufficiency, like I said, include fatigue, muscle weakness, decreased appetite, and weight loss. Some people experience lightheadedness, dizziness, nausea, vomiting, abdominal pain, and diarrhea. Other symptoms include pain in your muscles and joints, low blood pressure, craving for salt. Now, that only happens when there is primary adrenal insufficiency, or the Addison's disease, that a person would crave salt. Symptoms of low blood glucose, such as sweating. That is more common in children, though, with adrenal insufficiency. Darkened skin on the face, the neck, and back of the hands in primary adrenal insufficiency. Irregular menstrual periods in women. Do you see how many things it can be? But that's why you got to know, you got to do your history on yourself. Monitor yourself before you go see a doctor, and don't get upset because they're asking you umpteen questions and tell you thought that they were going to fix you the day you went. And then let me tell you something. If you already walk in the door with a presentation that says, help the doctor differentiate and narrow things down because you understand this stuff a little bit enough to say, I have been going through this for months now. It keeps coming back, or it never went away. Having that type of history or knowledge, or have it written down. Okay, when did this first start? Does it happen every day? The frequency. How long does it last? These are questions that you gotta walk in the door prepared. Make it easy. Look, I've been going through this for such and such and such. It's not medication induced because I'm not taking the medicine. You get all okay. I'm just telling you. All right. Some people don't know they have adrenal insufficiency until they have a sudden worsening of symptoms called, and that's it. Adrenal crisis. I couldn't think of it earlier. But yeah, an adrenal crisis. Physical stress caused by illness, infection, surgery, or an accident can suddenly make symptoms much worse. An emergency illness called an adrenal crisis is what that is. And if left untreated, adrenal crisis can cause death. Adrenal crisis occurs mainly in people with primary. This is the Addison's disease. People in adrenal crisis need an injection, a shot of glucocorticoids. That is why if you have adrenal insufficiency, you need to tell your surgeon so that you will not have an adrenal crisis during surgery. So you go into surgery and it's supposed to be a little simple whatever, and you end up in intensive care with an adrenal crisis only because you didn't get a shot of steroids. You feel me? See how it could have easily been avoided? Okay. So, you would need to go to the hospital right away. And it says if you do have adrenal insufficiency, it's recommended that you wear a medical alert, bracelet, or tag and know the warning signs of adrenal crisis. Now, these are the symptoms of adrenal crisis. Severe nausea and vomiting. Now, when I say severe, I mean severe. Diarrhea, abdominal pain, dehydration, and confusion. When people get dehydrated, they're tinting of the skin. Anyway, low blood pressure and even fainting. Yeah, passed out. So the goal of treatment is to ensure proper hormone levels day to day. You may need daily replacement of hormones for life. You will take glucocorticoids to replace the cortisol your body no longer makes. You may also need mineral corticoids if your body does not make aldosterone, a hormone that regulates blood pressure. Yep. People don't understand that thing about the blood pressure. Blood pressure is the kidneys and the adrenal glands. But primarily a lot of it's kidney. Okay. But extra glucocorticoids may be needed during times of stress, like I said, serious illness or surgery, like I said. Your doctor will provide personalized advice on adjusting medicines for stress. Now, What I want to go through real quick is talk to you a little bit more about the testing at the end of this that is done for diagnostic purposes. So when we come back on next week, we can just, smooth sailing. All right. So I don't know what happened, but my little yellow light went green again. I don't know, y'all. It's always something. This is a topic that needs to get out there. And anyway, let's just keep going. But I'm monitoring this computer over here. So diagnosis of adrenal insufficiency and Addison's disease, primary and secondary. All right. First of all, like I said, your doctor will review your symptoms. That's why you got to have your symptoms down and run tests to confirm that your cortisol levels are low. So they're going to do the cortisol test. In its early stages, adrenal insufficiency can be hard to diagnose since symptoms come on slowly. Your healthcare professional may suspect it after reviewing your medical history and symptoms. That's why I said you got to have your stuff together. The next step is blood testing to see if your cortisol levels are too low and to help find other cause. And that's why we're going to talk thyroid next week, so to differentiate between the two. So, ACTH stimulation test. That's what I was telling you earlier. The ACTH stimulation test is the test used most often to diagnose adrenal insufficiency. In this test, a healthcare professional will give you an IV injection of man-made ACTH. And that is the adrenal corticotropin hormone. Okay? Man-made, synthetic. So your healthcare professional will take samples of your blood before they give this to you, 30 minutes after they give it to you, or 60 minutes after the injection. And most of them will do all three. It just depends on the results of the 30-minute versus the 60. So the cortisol levels in your blood samples are measured in a lab. Okay? The normal response after an ACTH injection is a rise in your blood cortisol level. So they expect your cortisol level to go up when they give you this, because this is a stimulating hormone. People with Addison's disease and most people who have had secondary adrenal insufficiency for a long time, they have little or no increase in cortisol levels. So they give you this injection and your levels don't go up. The adrenal glands may be too damaged to respond to ACTH. The ACTH test may not be accurate in people who have had secondary adrenal insufficiency for a shorter time because their adrenal glands have not yet shrunk and can still respond to the ACTH. There is also another test that can be done, and that's called an insulin tolerance test. I know you're not going to understand all of this, but at least you'll be aware of it if you heard it again. You will say, I know that there's at least 2 or 3 tests that can be done, doc. Okay? And of course, we know cost is a factor too. Depends on how much the test costs. And if it's available at that where you're at. Okay? So, if the results of the ACTH stimulating test aren't clear, if they're not clear, or your doctor suspects a problem in the pituitary gland, which is secondary, you may have an insulin tolerance test. It's called an ITT. What happens is the healthcare professional will give you an IV injection of the hormone insulin. You're not diabetic, but they're going to give you a shot of insulin. They anticipate that your blood sugar is going to drop, okay? So they're going to give you a shot of insulin, which lowers your levels of blood glucose. The dose is high enough to cause hypoglycemia, which occurs when your blood glucose level drops too low. So what they're trying to do is see if your cortisol, your adrenal gland will produce cortisol and cause your blood sugar to go up. So the hypoglycemia causes physical stress, which normally triggers. That's how it works. The blood sugar drops, physical stress of having that low blood sugar, which triggers the pituitary gland to make more ACTH. That's why it has to be done by a healthcare professional. So if you're positive and it didn't work, they need to give you some glucose, some dextrose to get your blood sugar up. Okay? So what they'll do, they'll draw your blood at the beginning of the test. Again, every half hour during the next 2 hours. So this is, do you remember when, or I don't know, women who've been pregnant, they'll do what they call a glucose tolerance test to see if you're hyperglycemic during pregnancy. Well, this is the opposite. So during the glucose tolerance test, they give you a burst of sugar to see if your pancreas can produce enough insulin to lower the blood sugar, and they test your blood sugar during, an hour after, 2 hours, 30 minutes, an hour, and 2 hours, I think. And this is the opposite, right? It's just the exact opposite. They're inducing hypoglycemia. I'm telling you, the things that God has given man wisdom and knowledge to do. If your cortisol levels are low, your pituitary isn't making enough ACTH, so your adrenal glands don't make enough cortisol. The ITT is the most, let me say it again. The ITT, insulin tolerance test, is the most reliable test to diagnose secondary adrenal insufficiency. It's the most reliable test to diagnose if it's a problem with your pituitary gland itself. Okay? I hope this makes sense. Go back, listen to it again. Next week we'll rehash and I'll try to make it even clearer. I'm almost done because there's one last test I want to talk to you about and we'll be done. Okay. Very low blood glucose levels can be dangerous. So, like I said, a healthcare professional must be present at all times and make sure blood glucose levels don't drop too low. And this test is not safe for people with heart disease, a history of seizures, and other serious illnesses. It's not. Because if you have heart disease and your fight or flight stress on your body can cause you to have a heart attack or can cause you to have a seizure. Seizures many times occur due to an imbalance in your brain. Isn't that not where your pituitary gland is? Okay. The last test is a CRH stimulation test. The CRH stimulation test is another option to help identify secondary insufficiency if the results of the ACTH test aren't clear. This test can also tell secondary from tertiary adrenal insufficiency. A healthcare professional will give you an IV injection of CRH, corticotropin releasing hormone, CRH, and take samples of your blood before 30, 60, 90, and 120 minutes after the injection to measure ACTH levels. If the pituitary is damaged, it won't make ACTH in response to the corticotropin releasing hormone injection. So, pituitary, sends the CRH sends the ACTA. I'm telling you, it's complex. But I don't expect you to know that. All I expect you to know is there is such a thing as adrenal insufficiency, the symptoms, and you have to know what's going on with you in order to be able to differentiate. You do not want to have an emergent situation come up and it went undiagnosed. So when we talk about hypothyroidism on next week and we compare the two, and it'll really make good sense. This is just the beginning. Fight or flight versus fatigue. I hope and pray that this information will be a blessing to you. Thank you for pardoning me for being tardy, because I could not find my little kidney, okay, with the adrenal. And honestly, what better description for me to hold this in my hand and show you the cortex of the adrenal gland. This is where those hormones are. Okay. All right. Well, God bless each and every one. We're going to talk about adrenal burnout and chronic fatigue versus hypothyroidism on next week. I hope you got your fight or flight. Woohoo! Because I'm getting ready to get mine on. Try to find me some dinner. Okay, fight or flight. What's in the fridge? All right. Anna Shaw Devlin, Dr. Anna Shaw Devlin, saying adios, amigos. Thank you for watching. And yes, I have viewers, not just in North Carolina and Greensboro. Let me just say, I have them all over, and I thank God for each and every one of you. We are working on getting the website, YouTube, all of that stuff more out there. Okay, so please let people know about us so that they can follow us and continue to learn what you need to know to better care for yourself. All right, God bless you. Have a good one. We'll see you Sunday.